Hi, I'm Dr. Devin Colburn, owner of Colburn Chiropractic, and I'm going to show you a few exercises today to help with low back pain. So the first exercise I want to demonstrate today is called a good morning. So this is going to help in stretching out and tractioning the low back and then recruiting those same muscles to then contract it back up and get blood flow and healing going in the low back there. So I'll demonstrate. We're going to stand here with our hands above our head, straight up. We're going to bend over forward and get a nice stretch in the low back. And then use the same low back muscles to contract and pull us back up. And we're going to do several reps of this. Now again with the good mornings, we're going to start at 10 to 15 reps. If that doesn't cause pain or doesn't worsen your condition, go to 20, 30, or even 50 reps at the most. Just listen to your body and do what feels best. If it causes any discomfort, definitely back off. No reason to push it. Otherwise, you can push up anywhere to that rep range. And I would do 3 to 5 sets for one session. You can do anywhere from 2 to 3 times a day. But 2 to 3 sets, maybe even up to 4 sets at most, 10, 20, 30, 40, 50 reps, depending on where your pain level is. Okay, so for the next exercise for low back pain, we're going to traction out, decompress the low back. We're going to use a table here. You can use a table, you can use a countertop, a couch, or bed. What we're basically going to do is you're going to lay your torso over the front here and get it to a point where your low back is hanging off. And if you're supported in the torso enough, you can basically hang and dangle your legs off. I'm using my toes to balance here just to demonstrate. But we'll support the upper torso and then let the low back hang off and let your weight just sink down and pull your low back out. And we'll do this easily. If it causes any pain, definitely back off. Don't overdo it, obviously. But if it feels good and it doesn't cause too much pain, definitely just let your back ease down with gravity and hang off of the table. And that's going to allow your low back to traction out and decompress the pressure on the disc, the joints, and decrease some of that pain that's going on there. It's a good one if you have sciatica and get pressure off of the nerve that's getting pressure on it that is radiating into the leg. So give that a try. I would do 20 seconds at a time, up to, if you're doing it a lot and feeling good, you can do it up to a minute at a time. And then I would rest for 30 seconds. And then you can do it 3 to 5 times in one session. I would recommend doing this 2 to 3 times a day. Okay, for the next exercise for low back pain, we're going to do a motion, it's a swinging pendulum motion that's going to help traction out the low back. So you can find like a door frame or a wall, something to prop up on. And so you're going to take your leg that has the radiating pain down it and do a slight pendulum motion where you let gravity, you recruit the muscles and do it yourself, but also let gravity assist you in like a pendulum motion. And that's going to help get some flexibility and tractioning out and relax that low back and keep a good upright posture. And that's going to help get some motion and use the swinging momentum to help open up and traction out that low back. Again, take it easy and build up to whatever you're comfortable with. You can even get a greater swinging motion if you're working more for flexibility and range of motion. And then you can also turn and do it vertically also, straight on and straight back like this. And that's going to help lengthen out, and you recruit the low back muscles on the back swing, and then let it go forward and recruit and swing forward. And so we're getting tractioning and then recruiting those muscles to strengthen at the same time. So again, you can do it laterally, sideways, out in front of you, or you can go out front and go front and back, straight up and straight forward. Give that a try. I would do 20 reps to start out with. 10 if it's causing a lot of pain. Take it easy and sort of build up that 20 reps. But if you're feeling good and feeling strong, you can do 30 reps, even 60 reps at one time. Then I would give it a rest, 30 seconds in between, and do about 2 to 3 sets in one session. You can do this 2 to 3 times a day. Okay, for the next exercise for low back pain, we're going to do a stretch here where we bring the heel up, and it's going to be a glute stretch. We place the heel on the knee, and then we're going to bend forward until we feel a stretch along the sides of the low back and the glutes on that side. And then you can even use this hand to press this knee down and bend forward and try to get the best traction and pull on the glutes and the low back on this side. And so this is going to help increase flexibility and decrease pain in the low back or the hips. So do this for 30 seconds to a minute per leg, and then swap and do the other leg. And you can do this for 3 to 5 times per session. And one session you can do a session 2 or 3 times a day. Now for low back pain, we're also going to do a stretch for the hip flexors. A lot of times tight hip flexors can cause tightness of the psoas muscle and restrict the low back functioning. So you'll use the surface like a table or a step or anything that you can find to assist, where you can place a leg up on it and then press your hips forward. And we're going to stretch out the hip flexors. And this is we're going to want to hold that for 20 to 30 seconds. And that's going to help get some relief and some flexibility in the hip area and the pelvic region to decrease those muscles that can tighten up the low back pain. Okay, for the next exercise for low back pain, we're going to do a cobra stretch. So you're going to find a surface here. You can do this on the ground, on a bed or a table. And so you'll go flat, and then we'll use our hands to press just the torso up. And we're going to want to feel a stretch through the abdominals and through the front of the torso here. And we're going to want to hold that and just feel it. If you can only go up to this degree, just go to that degree. However high you can go up, push up and hold. And you want to feel a nice stretch in the front of the abdominals. And so this is going to help lengthen that area to help decrease low back pain and increase flexibility in the area. A lot of times if you have a disc bulge or a disc herniation going on, this benefits it because that position is assisting with gravity. The disc bulge is out the back of the spine, and this helps gravity force it back into the correct positioning. So if you have a disc bulge, that is a very beneficial stretch to do. If it's too painful to do initially, you can add pillows underneath your stomach or underneath your torso to help assist, and then work down to whatever degree you're comfortable with. You can use pillows to assist you. But if you can get a good stretch in that area, that's going to provide a lot of relief and benefit.